Hi, it's Michelle again, and today I wanted to do a part 3 video of wrist exercises. So today we're going to focus more on wrist strengthening exercises. So part 1, if you haven't watched 1 or 2, go back and watch those before you progress to strengthening if you haven't gotten your motion pretty much back to normal. So part 1 focused on just active motion, just working on using your own muscles to get the wrist moving and the forearm. And then part 2 was pushing to get your movement going, so more passive motion. So using your other hand to help get a little bit more motion that your muscles can't quite do for you. And part 3 today that we're going to work on is strengthening. So I got a couple of things that you may have at home that you can use. You don't necessarily need to buy a bunch of things. You can use some household items that you have, but I am going to show you a few things that maybe you don't quite have on hand, which might be like a little wrist weight, or a band, a TheraBand of some kind. So there's a few exercises you could do with that too. So with that, I wanted to start by showing you a few simple wrist exercises to get started with, and you're going to want to prop your wrist up on a pillow, or you can do it off the edge of your recliner or the edge of a table. And I'm going to just turn myself to the side so you can kind of see what I'm doing. And the first exercise that I'm going to show you is with a little wrist weight. So if you don't have a wrist weight, you can use anything that you have at home, a water bottle with some sand in it, or I've had patients tie a few tools together like wrenches, or get a baggie with some coins, some quarters, and just some change, loose change that you have around to make it to be like a pound or 2 pounds. So if you haven't started strengthening yet, you'll want to use like a light weight of some kind, nothing too heavy. So I've got a 2-pound weight here because I don't have a wrist injury, so I'm just going to start with a 2-pound weight, and I got this at a garage sale, and I think that was for like 50 cents or $1. So first set of exercises we're going to do are called wrist curls. So hanging the wrist off the edge of a pillow or the table, you just simply want to do about 10 to 15 wrist curls. So you're coming down as far as you can go and up as far as you can go, just within a normal range of motion. And again, about 10 to 15 or so. And then you want to turn the hand up with the thumb up towards the ceiling. You don't have to stick the thumb up, but that's the position you want to be in. Then what you want to do is do wrist radial and ulnar deviation. So that's where you're going side to side. So this is strengthening more radial deviation, so coming up. And you can sometimes place your hand on your forearm so that you don't kind of do this motion, which is what people sometimes will do. So just this way, up and down. Then turning your hand palm up, and then you're working on wrist flexion. So wrist curls, up and down. Good. And about 10 to 15 or so of those. You can also work on strengthening ulnar deviation by going in different directions as well. You can do it this way, or you can stand, and then you can put the, which I'll kind of show you here, is you can put the weight kind of down and work more this way. You can do it with the arms straight and do it this way, or working ulnar deviation more this way. And that's just working on this strengthening side. So that's with the loose weight. You can also do the same set of exercises with a band. So you can find these stretchy bands pretty much anywhere. And I'll provide a link at the bottom of the bands that I use, and you can purchase them there. So the bands come pretty big, so you don't need all of this. You would just want to you could make a little loop with it to hang on to. So just by tying a little knot, you can make a loop, and then you want to put your hand in there. You can make a big one or a small one, and then you can do the same set of exercises, but do this with a band. So you could do these where you're coming up and down this way. You can do it with the fingers open, or you can curl and hold on to it and do it this way. I prefer to have you hold on to it just because you're really isolating the wrist tendons this way by just moving the wrist and not letting your fingers help lift your wrist up. So this one you could do this way, and then you could then turn and you could do it in flexion. Or then you can also turn and do it this way in radial deviation. And then you could also then hold it this way and go out in ulnar deviation. So you're going in that direction towards your small finger. And that's a good way. That way you don't have to kind of come down with the weight like I showed you before to work on that strengthening exercise. So that's a good one for weights. Or for bands. You could do so many other exercises with the bands for your elbow and shoulder and forearm, but those are some simple wrist exercises to do. Now, just to back up a hair, if you can't do any kind of weight or bands, then simply get something that has no weight to it. So like a highlighter, where you're doing those same exercises and you're just isolating the wrist, but you've got something pretty small, pretty light, and you're just working on moving that wrist and getting the mobility without too much weight and coming up and down. So flexion, extension, radial deviation, and then ulnar deviation, side to side. So that's an option. And then another one, you might wonder why I have this spatula here. So a good one for your forearm, so to get that forearm up and down motion, the supination and pronation, is using a spatula to help the weight. The weight of the spatula can help pull you over and help stretch this out and strengthen your forearm rotators. So you can go up this way and then go down this way, keeping your elbow at your side. If that feels pretty easy and you don't need that anymore and you want to up it a little bit, then you can go to a hammer. And the hammer provides a little more weight to help pull you over. And you can also just work on moving the wrist in various directions with the hammer. It gives it more of a simulated activity, working on that wrist and hammering motion. Now, another one that's kind of unique and different to the strengthening exercises doesn't necessarily provide strength, but it helps with your just your mobility and your proprioception, which is your wrist knowing kind of where things are in space. So if you're holding a dish or you're holding a cup with some coffee in it, you have a bowl that has some soup in it, anything like that. Sometimes when you've had a wrist injury or hand injury, you don't quite know, you don't quite get that feel of what is what's inside that bowl. So sometimes practicing different types of proprioceptive exercises will help you with your hand kind of know where it is in space and how to adjust and how to change positions and directions. And it takes a little bit of thinking. It might be easier on your dominant side than your non-dominant side, but taking a simple frisbee with a small, you can use a small ball or a tennis ball, and you're just simply rotating it around. And you can see my hand is just kind of working on a small little circular mobility without moving my elbow. I'm not moving this whole arm and elbow. I'm just simply moving my wrist. Now let's see if I can do this with my other hand. Might be a little bit more difficult to do it on the other side. So you'd want to go like clockwise a couple of times and counterclockwise a couple of times. And making sure you're breathing, not holding your breath. Sometimes I do that too. I hold my breath when I'm trying to do my exercises, and we want to make sure that we don't do that because we need that oxygen throughout our body. Okay, so those are some simple exercises. Didn't take too long. Hope that helped. And stay tuned for more exercises on other body parts and positioning that can help you throughout your day and in your recovery. Thanks.